Good morning, students. Welcome to the part 2 video lecture of Anatomy of Middle Ear. In this part, we will discuss about the ear ossicles, joints of the ossicles, muscles of the middle ear. Then we'll also deal with the blood supply, lymphatics, and nerve supply of middle ear along with its clinical anatomy. So let's start with the ear ossicles. So as I have already told you in my previous video lecture that there are three ear ossicles, the smallest bones found in human body, and these three ear ossicles are the malleus, incus, and stapes. So first of all, we'll talk about malleus. The malleus, as you can see, why it is called as malleus, because it resembles like a hammer. Yes, this is the handle of the hammer and this is the head of the hammer. So as this malleus is resembling like a hammer, so is the name given to this bone, that is malleus, and it is the largest and most laterally placed ear ossicle. You can see in this figure that as compared to these three, as compared to these two ear ossicles, this malleus is the largest one and it is placed most laterally. That means this side is the anterior side, or you can say this side is the side towards the external ear and this side is the side towards the internal ear. So this is the most lateral and the largest ear ossicle. Now it has following parts. First of all, the topmost part is the head. Yes, you can see this is the rounded head which is lying in the epitympanic recess. In my first video lecture, I have told you about the two parts or two parts of tympanic cavity, that is the tympanic cavity proper and the epitympanic recess. So this head of the malleus, this rounded head, lies in the epitympanic recess and it is articulating posteriorly to the, you can see it is articulating posteriorly to the body of the incus. Yes, this is the body of the incus and this head of malleus is articulating with this body of the incus posteriorly. Now the talking about the second part, this is the neck. Yes, the neck which is lying just against the pars flaccida. Okay, if you remember the tympanic membrane, then you can you know what is pars flaccida. I'm not going to repeat it again and again. So pars flaccida is in level of this neck of malleus and this is also related medially towards the chorda tympanic nerve. Now you can see there is a conical projection just near the neck, just below the neck. This is called as anterior process. So this anterior process is there to connect the petrotympanic fissure by the anterior ligament. Yes, I have already discussed about ligaments in within the middle ear cavity in the previous video lecture. So under the heading contents of middle ear. So this anterior process give attachment to the anterior ligament. Then we have another process, that is the lateral process, which is not visible in this figure. So the lateral process projects from the upper end of the handle. This is the handle. So here, from here only, the lateral process projects and it is from back side or posteriorly, and it provides attachment to the malleolar fold. Now the last but not the least is the lower part, the handle, which is extending downwards and backwards as well as medially. You can see it is extending downwards, backwards and medially, and it is attached to the upper half of the tympanic membrane. Yes, you can remember the lecture of tympanic membrane, and in that I have already told you that this handle is in relation to the upper half of the tympanic membrane. Okay, and the tip of the handle is the maximum point of convexity of the tympanic membrane, which is known as umbo. Now talking about the second ear ossicle, that is the incus. This incus is already also known as anvil. And why it is known as anvil? Because it resembles the anvil. Anvil is the instrument which is used by blacksmiths. You can see anvil very easily on roadside where a blacksmith is sitting. So it is the same instrument on which the blacksmith uses to mold the iron. So this anvil is just like incus, or this incus is just like an anvil. That is why it is also known as anvil. Now it also resembles the molar tooth. Yes. So it has the following parts: the body, the uppermost part is the body, which is the largest part and bears an articular surface which is articulating anteriorly to the head of the malleus. Okay. Now we have a long process. Yes, you can see in this figure, it is labeled here, the long process. And this long process is projecting downwards just behind and parallel with the handle of the malleus. You can see this is the handle of the malleus, and just parallel and behind to it, this is the long process of the incus. And this long process has at its tip a projection that is called as lentiform nodule, and this lentiform nodule attaches or articulates with the head of the stapes. Okay, you can see here, this is the lentiform nodule which is articulating with the head of the stapes. Now talking about the third ear ossicle, that is the stapes. So stapes is known as by its name, that is stapes, because it is shaped like a stirrup. You can see it is shaped like a stirrup, and this stapes is the smallest ear ossicle and most medially placed also. Now, there are following parts in this stapes, as you can see in this figure. The topmost part, which is articulating with the lentiform nodule of this incus. This is the head. Yes. So the head is small and has a concave facet, which bears or which allows the attachment with the lentiform nodule of the incus. Then we have the narrow neck. You can see this is the narrow neck which provides insertion posteriorly to the thin tendon of stapedius. When we will discuss about the two muscles of medulla, then the two muscles are the tensor tympani and the stapedius. So this neck gives attachment to the stapedius muscle. Now there are two limbs, you can see this is the posterior limb and this is the anterior limb. So there are two limbs or crura of stapes, the posterior limb and the anterior limb. The talking about the posterior limb, this limb is longer as compared to the anterior one, and it is diverging from the neck, as you can see, and is attached to the foot plate. Yes, the foot plate or foot piece, or even you can say the base, is oval in shape and fits into the fenestra vestibuli. Fenestra vestibuli is already discussed in previous video lecture. So this foot plate is attached to the fenestra vestibuli. Now we'll discuss also two joints of the ossicle, as you can see in this figure, the incudo-malleolar joint and the incudo-stapedial joint. Both these joints are synovial joint. Yes, both these joints are synovial joint, and the types of synovial joint, they both are different types of synovial joint. The incudo-malleolar joint is saddle type of synovial joint, and the incudo-stapedial joint is ball and socket type of synovial joint. Okay, and you can see in this figure that these two joints are surrounded by a capsular ligament also. So both these joints are synovial joint, the incudo-malleolar and the incudo-stapedial, and the types are, the incudo-malleolar is saddle type of synovial joint, and the incudo-stapedial are ball and socket type of synovial joint, which is covered under a capsule or within a capsule. Now, yes, moving on to the muscles of medulla. So, as I have already told you that there are two muscles, the tensor tympani, yes, the tensor tympani and the stapedius. So, both these muscles, what is the function or what is the utility of these two muscles in the middle ear? Both these muscles act simultaneously to generally damp down the intensity of high pitched sound. Okay, so the high pitched sounds basically damages the internal ear. So these two muscles simultaneously act to damp or slow down this high pitched sound waves so that the internal ear can be protected. Now, first of all, we will discuss about tensor tympani. So you can see this tensor tympani, it lies in a bony canal. When we have discussed the anterior wall or the tegmental wall of the yes, anterior wall, not tegmental wall is the roof. The anterior, when we discuss the anterior wall of the middle ear, then you know that it has two canals. So the upper canal or the superficial canal, superior canal, is the canal in which this tensor tympani muscle resides. Now this is open at its lateral end on the anterior wall of the middle ear. Yes, and at the medial end on the base of the skull, if we'll talking about the, if we'll see this relation of this canal in relation to the base of the skull, then you will see that this canal is at the medial end on the base of the skull. Now the auditory tube, this pharyngotympanic tube or the auditory tube or the this auditory tube lies just below this canal. Okay, it's taken tube or this auditory tube, you can see it lies just below this canal, and the muscle, the tensor tympani, as you can see in this figure, it is arising from within this canal. The tensor tympani muscle is arising from the same canal in which it lies. Yes, and the muscle ends in a tendon. This muscle, the tensor tympani, which is ending in a tendon, which is reaching the medial wall of the middle ear, as well as it is bending. You can see it is bending very sharply and is attaching towards the processus cochleariformis. Yes, and then it is also passing from this processus cochleariformis laterally and crosses the tympanic cavity to be inserted into the handle of the malleus. Yes, this is the malleus and this is the handle of the malleus, and you can see the tensor tympani muscle, the ligaments of the tensor tympani muscle is inserted into this uh, handle of the malleus. Now the second muscle, the stapedius lies in a bony canal that is related to the posterior wall of the middle ear, and the posteriorly and below this canal there is a continuous and vertical part through which facial nerve enters. Okay, so the muscle, this is stapedius, this is arising from this wall of the canal. Okay, so similarly to the tensor tympani, the this stapedius muscle is also arising from the wall of the canal in which it lies, and it is inserted to the posterior surface of the neck of the stapes. Yes, you can see. So it is inserted into the neck of the stapes, basically posterior surface of the neck of the stapes. Now, talking about arterial supply of the middle ear. So in this figure, you can see that there are some arteries which is numbered, and these numbered arteries are labeled here only. So the main arteries that is supplying the arterial blood to the middle ear are the anterior tympanic branch or the anterior tympanic artery of branch of maxillary artery. Yes, and the posterior tympanic branch of the posterior tympanic artery, which is a branch of stylomastoid artery, and this stylomastoid artery is a branch of posterior auricular artery. So maxillary artery and posterior auricular artery is basically giving branches, that is the anterior tympanic artery and the posterior tympanic artery, which is the main arterial supply of the middle ear. And there are also some small arterial supplies, arteries that is supplying the arterial blood to the middle ear, that is the corticotympanic artery. Yes, this corticotympanic artery is the branch of internal carotid artery, and then we have the inferior tympanic artery number 2. Yes, this is the inferior tympanic artery, and this is a branch of ascending pharyngeal artery. Yes, this is a branch of ascending pharyngeal artery. This is ascending pharyngeal artery, and this is the inferior tympanic artery, branch of ascending pharyngeal artery. Then we have the deep auricular artery. Yes, third one, there is the deep auricular artery. And last but not the least, we have the superior tympanic artery. Okay, so the superior tympanic artery is the branch of the middle meningeal artery. Yes, this is the middle meningeal artery, and the superior tympanic artery, this is the superior tympanic artery, which is a branch of middle meningeal artery. So these are some small arteries which also supplies arterial blood to the middle ear, but the most important one or the main arterial supply is the anterior tympanic artery, branch of maxillary artery, and the posterior tympanic artery, branch of stylomastoid artery, which is a branch of posterior auricular artery. Now, talking about venous drainage of middle ear, so all the venous blood from the middle ear will drain into the superior petrosal sinus. Yes, you can see this is the superior petrosal sinus, this is the inferior petrosal sinus. So the arterial blood is draining into the superior petrosal sinus from the middle ear, and as well as the pterygoid plexus. This is the pterygoid plexus in which venous blood, remaining venous blood will drain. Middle ears remaining venous blood will drain. Okay, so now there are two venous sinuses or plexus you have to remember in case of venous drainage: the superior petrosal sinus and the pterygoid plexus. So this pterygoid plexus and superior petrosal sinus will receive venous blood from the middle ear. Lymphatic drainage, all the lymph will finally drain into the pre-auricular group of lymph nodes and retropharyngeal or the tonsillar group of lymph nodes. Okay, so the pre-auricular and the retropharyngeal or tonsillar group of lymph nodes will drain all the lymph from the middle ear cavity or the middle ear. Then last but not the least is the nerve supply. So nerve supply is derived from this tympanic plexus. Yes, you can see this is the tympanic plexus, and this tympanic plexus is lies just over the promontory. When we have discussed the boundaries of middle ear, then I have told you about the promontory. So the medial wall has promontory, and then this tympanic plexus supplies the nerve fibers or nerve endings to the middle ear, and this plexus is formed by the tympanic branch of the glossopharyngeal nerve, the ninth cranial nerve. Yes, this is the glossopharyngeal, the ninth cranial nerve, and this is the tympanic branch of this glossopharyngeal nerve. And also there is a nerve fiber, the lesser petrosal nerve, which is arising from the optic ganglion. Yes, this is giving nerve fibers to form the tympanic plexus. The superior and inferior carotico-tympanic nerve, which is arising from the sympathetic plexus around the internal carotid artery, that also give nerve fibers to form this tympanic plexus. So this tympanic plexus is the main nerve which supplies the middle ear. Now, clinical anatomy of middle ear. There are two important clinical anatomy terms that we used to hear, or we generally we can see in the day-to-day OPD practices. The first one is the otitis media. Yes, you can study this topic under surgery, under the subject surgery, and it is classified as acute suppurative otitis media and chronic suppurative otitis media. So the otitis media generally occurs due to throat infections. Throat infections commonly spread in the middle ear cavity through the auditory tube or the Eustachian tube, and it causes otitis media. Yes, so the in otitis media, you can see this middle ear cavity is filled with pus. So due to this otitis media, there is accumulation of pus in the middle ear cavity, and it can take one of the course. It may be discharged to the outer side through the external ear, or it may erode the roof and spread upwards. Yes, it may erode the roof or the tegmental wall and can spread upwards, infection upwards, causing meningitis, and it can erode the floor. Yes, we have already discussed the floor. So the floor or the jugular wall, can be eroded by this pus of the otitis media, and the infection will cause thrombosis of the sigmoid sinus and internal jugular vein. Yes, thrombosis of the sigmoid sinus and internal jugular vein, you can see. And it may spread backwards also, causing mastoid abscess. Yes, it may spread backwards, causing mastoid abscess too. So there is another term, that is autosclerosis. What is this autosclerosis? Sometimes you can see here this oval window. In this figure, you can see there is an oval window which is created due to the bony fusion which is taking place between the foot plate of the stapes and the margin of the fenestra vestibuli, to which it is attached, to which the foot plate of the stapes is attached. So due to that bony fusion, there is sometime an opened oval window, and this open oval window can lead to cause deafness. Okay, patients having an open oval window at the fenestra vestibuli, at the junction of the attachment of foot plate of stapes in the fenestra vestibuli, can have a complaint of deafness, and this can be corrected surgically with the help of prosthetics, which is placed. You can see in this figure that the stapes is removed here, and there is a prosthetic which is placed here, and is attached to the lentiform nodule of the incus. Okay, so with this surgical intervention, this autosclerosis can be treated, and the complaint of deafness can be surgically corrected and removed. So this is all uh, in middle ear, in this topic middle ear. In next video lecture, or the last video lecture regarding ear, that is the internal ear, we will discuss the internal ear in detail. Till then, stay home, stay healthy, take care. Thank you so much.